I remember going to conventions 25 years ago and hearing Dr. Goodhart speak and just seeing genius on the stage. I remember taking my 100-hour course from Dr. Robert Blake and understanding that the simplicity of how he could explain a complicated subject like AK so a newbie like me could learn. I remember sitting down and talking to Dr. Sheldon and him showing me the greatest parlor trick in the world, which is to use somebody's photograph to weaken their muscles. I remember running out of a hotel with Dr. Cohn after Dr. Tim Francis realized we ran up a $1,200 liquor bill in the bar. Remember that, Tim? Yeah, I bet you do. Coming to dinner tonight? My fondest memories, though, is you get into a room like this, 300-400 doctors, all looking to improve themselves so that they can improve their practices, so that they can improve their patients. And I'm touched to finally be here and be on the stage and be a part of that. So with that, let me give you some good news. I'm a doer. I like to get things done and I like to do it my own way. So one thing I realized is there are a lot of people out there that have no freaking idea of how great we are. I mean, I keep telling them I'm great, they just don't listen to me. A couple of times I've had my mother call, that didn't help either. So I wrote a book, and the book is called Misdiagnosed: The Adrenal Fatigue Link. We have some copies if you want in the back. The important thing about the book is this, not the fact that I wrote it. I guarantee you, how many of you know how to treat adrenal fatigue? Yay. We all do it. And as a matter of fact, when you read the book, it talks a lot about applied kinesiology and how 25 years ago when I took the class, we went over this. But now we're going to bring it to the front of what's going on. Now I tie it into neurotransmitter and brain chemistry and N.E.T. to really get people involved, to let them know that even if you're diagnosed with these crazy disorders of today, of anxiety, depression, chronic fatigue, fibromyalgia, it doesn't matter. We have the answer, and the answer is applied kinesiology and N.E.T. and some of the other work that we've been doing. How many of you get phone calls saying, oh, I was referred by the ICAK? That's a lot of us. We send out 2 to 3 dozen phone calls a week from our office back to the ICAK, just from the book alone. So I wanted to find out how important the work we're doing is and how I could really benefit this group. And because I truly believe that when one of us succeeds, that's great. When all of us succeeds, we're changing the world. So Howie and I were speaking yesterday, and one of the things that we spoke about was how powerful is the work of this book going to be for this association. And what I did was I posted on my Facebook page, which is the Adrenal Fatigue Link, and said, listen, I'm going to make a short announcement at this convention, and if you send me your zip code, I will find you a doctor who knows how to treat you. Guess how many replies we got in the course of 24 hours? I'll just make it simple. We're averaging 10 to 12 an hour. We're up to about 132. If you want a new patient, come talk to me. We have dozens. And if you're in Pittsburgh, you're golden because we've got 10 from there. But we've had replies from New Zealand, Australia, Peru, Canada, England, Ireland. This is powerful stuff. We're going to be bringing patients to the ICAK members, so that's great. More importantly, we have an epidemic of soldiers, Marines, and veterans who need our help. Who better to help them than us, okay? Last year I completed a study on how to treat burnout and resiliency and PTSD in active duty Marines. In that program, we tested neurotransmitters, put them on adrenal supports, and did follow them up for 90 days. And in 90 days, we were able to improve their physical and emotional complaints with basic stuff that we all know how to do by 40%. In 180 days, the average person improved over 82%. That's pretty good numbers when you consider that when I was in the Pentagon, meeting with the Commandant of the Marine Corps, he goes, if you could help 7-8% of our guys, I'd be eternally grateful. 82%. 100%. 100% of those who participated improved at least 2 categories. We had 5 categories of burnout, of adrenal fatigue, and everybody moved up at least 2 levels, and 45% of the men actually became asymptomatic. We were getting notes back, changed my life, you've saved my family. We just had a Marine who was sent up from Florida, fought in Iraq, came back, they made him from a sergeant, they made him into a lieutenant. Same thing, we put him on a nutritional protocol. This one, we did hands-on N.E.T for 2 weeks, twice a day for 2 weeks. He was going to be discharged. They sent him up to get him better just to be discharged. After 2 weeks, he reported back to Pensacola, where he's from, requested to stay in, passed his physical, passed his psych exam. He's going to finish his tour. This is amazing. This is a guy who is about to go out on a lifelong disability. We gave him back his life, and now he's going to be a useful part of the military again, and a useful part of the United States. This type of stuff has gotten noticed. And so I'm happy to announce that I was given a grant. It became active 2 months ago, and it's several $1 million to spread this program across the country. Right now we're in 5 states. We're opening up in Massachusetts, New York, New Jersey, Mississippi, and Pennsylvania. They've already requested Florida and Delaware. And the protocol is nutrition, AK, and N.E.T. So who better to help than you guys? So if you're interested in working with these guys and helping them with their PTSD and bringing them back to usefulness, you need to stop by, talk to me, and we're going to put together a webinar to get started next week. There's huge opportunity out there now. Obamacare, how many of you like Obamacare? Obamacare is the greatest thing that's ever going to happen to our profession and our group ever. No longer will we be picking up the scraps of somebody who decides they want to come to us. No longer will people have a $5 copay to see their doctor and a $50 copay to see a chiropractor. No. Obamacare is so terrible that nobody has coverage for anything. The average person on Obamacare has a $2,000 deductible and a $45 copay. So you ask yourself, when it starts to sink in, are you going to go to your physician who's going to give you medication that you can't afford? Are you going to go to a physical therapist who doesn't have any idea of what to do? Or are you going to go to a chiropractor, an applied kinesiologist who can give you the answer and prevent disease in the future so that you're stronger and better than you ever were? Their failure in the healthcare system is going to be our success. Let's get healing.